A very good evening to all of you. Today, we are going to do the challenge of pathology. Pathology has about 30 multiple choice questions in the Neet PG. It has some of the questions in medicine and pediatrics also come from pathology. So, this subject is the perfectly scoring subject. So, let us begin with the first question. Michaelis Gutman body are seen in Michaelis Gutman bodies are seen in A. Xanthogranulomatous pyelonephritis, B. Malakoplakia, C. Nail patella syndrome, D. None of the above. Now, here in the image, you can see Michaelis Gutman bodies. Now, this Michaelis Gutman bodies is seen in what are Michaelis Gutman bodies? Michaelis Gutman bodies are laminated mineralized concretions resulting from deposition of calcium in lysosomes. Enlarged lysosomes. They are typically present both within the macrophages and between the cells. They demonstrate positive results using past stain and they are diastase resistant. Diastase resistance. These Michaelis-Guttman bodies stain with COSA stain for calcium and Pearl stain Persian blue stain for iron. Immunohistochemical studies demonstrate positive results for CD68 antibodies. Now, this Michaelis Guttman body is seen in malakoplakia. Malakoplakia occurs with increased frequency in immunosuppressed transplant patients. So, this Michaelis Guttman body is seen in malakoplakia. Now, what is malakoplakia? Malakoplakia is a variant of cystitis. It is related to chronic bacterial infection caused by Escherichia coli or occasionally by Proteus species. It is characterized by unusually appearing macrophage and giant phagosomes. It points to defect in phagocytic and degradative function of macrophage. It has a peculiar pattern of vesicle inflammatory reaction characterized microscopically by soft, yellow, slightly raised mucosal plaques 3 to 4 millimeter in diameter. It is characterized by infiltration with large foamy macrophages with occasional multinucleus, giant cells, and interspersed lymphocytes. The macrophages have abundant granular cytoplasm and the granularity is PAS positive. In addition to these histological findings, malakoplakia is also characterized by Michaelis-Guttman bodies. What are Michaelis-Guttman bodies? Michaelis-Guttman bodies are laminated mineral concretions resulting from deposition of calcium in enlarged lysosomes. The correct option is malakoplakia. DIC is seen in. This DIC is a very important topic. Now, what are the causes of DIC? The causes of DIC can be due to endothelial damage. Endothelial damage can occur due to bacterial, viral, rickettsial, fungal, protozoal infections. Endothelial damage can occur due to shock, heat stroke, snake venom, drug or antigen antibody complexes. This DIC can also occur due to release of thromboplastin. This thromboplastin is released in obstetric complications in AML M3 type, AML M3 type, intravascular hemolysis of various origins, trauma, head injury, and major surgery and malignant tumors. The four options are A. Acute promyelocytic leukemia, B. Acute myelomonocytic leukemia, C. CMC, and D. Autoimmune hemolytic anemia. It is acute promyelocytic leukemia, that is AML M3. Let us move on to the next question. You can directly WhatsApp me on this number 94836522020 for any type of clarifications or doubt clarifications. It will be very helpful. Liquid fatty necrosis is seen in A. Heart, B. Brain, C. Lungs, D. Spleen. So liquid fatty necrosis is seen in which condition? Which organ? Is it the heart? Is it the brain? Or is it the lung or the spleen? So what do you think? See from the image which organ is that? It gives the clue. Liquefied necrosis is seen in the brain. Flare in triple response. From the image, you can see the triple response is mediated by A, axon reflex, B, arteriolar dilatation, C, histamine release, and D, local hormones. It is due to axon reflex. Cystic medial necrosis. You can see the black arrows. It is a cystic medial necrosis. It's seen in A, Marfan syndrome, B, Friedreich's ataxia pattern, C, Down syndrome, D, Kawasaki syndrome. This systemic medial necrosis is a disorder of large arteries, characterized by accumulation of basophilic ground substance in the media with cyst-like lesions. It is known to occur in certain connective tissues diseases such as Marfan syndrome, Ehlers-Danlos syndrome, annuloaortic ectasia, which usually result from degenerative changes in aortic valve. The relationship between cystic medial necrosis and congenital heart defect, as well as other disorders, have been evidenced. The mechanism are still controversial. So the correct option here is Marfan syndrome. Causes of constrictive pericarditis. Now, the causes of constrictive pericarditis, it can be idiopathic, it can be infectious, it can be viral. In India, TB is the common cause. Fungal, parasitic, post-cardiac surgery, post-radiation therapy, connective tissue disorder, uremia, malignant, in drug-induced sarcoids. So the correct option here is TB and brucellosis, D, A, and B. In cell death, myelin figures are derived from the cell membrane. Enzyme that protects the brain from free radical injury is superoxide dismutase. Fat necrosis is common in A, omentum, B, breast, retroperitoneal fat, D, all of the above. It is all of the above. You can see in the image, it is a fat necrosis. In apoptosis, cytochrome C acts through APAF1, which is activated for nuclear fragmentation in apoptosis. It is caspasis. Annexin V is a marker of apoptosis. Which of the following marker is specific for gastrointestinal stomach tumor? This from the table you can see CD117. So correct option here is CD117 is specific for gastrointestinal stomach tumor. S100 is specific for schwannoma, vimentin for glomus tumor, smooth muscle actin for leiomyoma, and glomus tumors. Multiple epidermoid cysts are seen in familial polyposis colony. The features of Crohn's disease are skin lesion, transmural involvement, crypt abscess, except lymphoid hyperplasia. Female is affected, male is not. Disease autosomal. What is the chance in children? It is 50% affected. The inheritance pattern of familial retinoblastoma is autosomal dominant. Male to male transmission is seen in autosomal dominant disease. Which is a feature of Down syndrome? A. Clinodictally pigmented birthmarks. C. Hypotonia, respiratory tract infection. It is pigmented birthmarks. Lines of John occur in coralline thrombus. You can click the link in the description box to join my 3-day masterclass, Neet PG masterclass, which will be very beneficial you. It will be a breakthrough class and it will be very useful for you. Please click the link in the description box and join. It is free. You can join it. Anemia with reticulocytosis is seen in A. Hemolysis. Maximum spirocytes are seen in. This is a picture of autoimmune hemolytic anemia. You can see spherical RBCs, that is, maximum spirocytes can be seen in autoimmune hemolytic anemia. The anemia associated with leukemia is it is a myelocystic type. Chemotaxis is mediated by leukotriene B4 and C5A. Hyperimmune IG syndrome is also called as. In Job syndrome, it is face course, abscess of skin, teeth is retained, eosinophilia is there, dermatological dental abnormalities are there. It is seen in Viscott allergy syndrome. Job syndrome. Correct option here is Job syndrome.